So there are sick funds that distributes the medical services to anyone in Israel, to any citizen and any resident in Israel. Full distribution. We are looking in our healthcare system in equality and still with a very high quality in the sick funds. And then you have the hospital. 95% of the beds, of the medical services in our system, in the inpatient system, are public. Mm-hmm. And there is an order because most of the beds are either governmental or run by sick funds.
Right.
Only a minority are what we are calling a public-owned hospital. Still, almost all the services are public. We have private services. The after hours, our physician, in some sort of a two-tier system, are working here in the morning, there in the afternoon. So we are achieving the order that we are looking at. And the regulatory body, the Ministry of Health, doing a great job in keeping and maintaining the system the way that is acting. And you saw.
So people shouldn't be afraid or deterred by the chaos.
Many countries around the world in the corona epidemic were looking how Israel is doing.
Right.
How Israel is doing when we had, 80,000 active corona patients a day. 80,000. And comparing that to other countries, it was a lot. It was a huge task. Still, most of them got the treatment in the community, in the sick funds. They were not flooding our emergency room. This is because our healthcare system is really focused in community care. We have the highest number of community clinics per population all over the world.
So I want to talk to you a bit about corona because you were for a number of months the coronavirus czar or commissioner of Israel.
All around the year, either running the hospital or running the father and mother shield for the nursing homes all around Israel, and then the corona time.
So on the one hand, Israel, like you just mentioned, did a very good job in keeping the hospitals not getting flooded. Mm-hmm. And per capita, though, our infection rate was a bit high.
Was one of the highest in the world. You can say that.
Correct. It was one of the highest in the world. Mismanagement throughout, to some extent. You spoke openly about this and your frustration at the time with the political echelon and just the difficulty. And we're still in this difficulty with the elections that are still going on, and we still don't have a government. On the other hand, an amazing vaccination effort, right? An amazing vaccination campaign.
An amazing job in keeping good treatment and good healthcare services for corona in the hospital and in the sick funds.
So how do you explain this? It's like a dichotomy. It's on the one hand, we're good at some things.
The dissonance.
How does it make sense?
First, the healthcare system got 10. Got a grade of excellence in running the epidemic, in running the challenge. Sick funds, hospitals, and vaccination. But then again, the combination of running corona is not only a healthcare challenge. It's the challenge of a country. It's the challenge of a government. It's a challenge of the trust, building the trust. Because when you want to control corona, this is not the healthcare system. Controlling corona is aligning with the public, giving them, the restriction or giving them the regulation in order to reduce the infection rate. And there, Israel did not succeed well. And
because that was more of a society issue, that was a cultural problem.
I believe that it took us in a point where there was some kind of disbelief to the government because we went through 4 elections campaigns, cycles, in a country that took the 4th one in the beginning of 2020. March 2020 was the 4th election campaign after a few years of mistrust. So you know what? This is making the public disbelief.
Right.
And then when you're asking them to sacrifice.
They don't have the trust foundation to make those
And
sacrifices.
sacrifice is not just sacrificing, the way that you live. It's sacrificing your wages, your freedom. And after the first wave, the Israeli citizens behave, perfect on the first wave. They really put their trust in the regulation, in the restriction, in the lockdowns. But once we experience a second wave, as early as June, first country in the world that experienced a second wave because we reopened after the first wave
Too fast.
too fast. Then
And you were warning that that wasn't going to happen. Right.
and then it all went crazy. People were not believing, were not doing what they should have done. And the second wave was very, very intense. We have kept that in June, July, and August. During the summer, we kept that, under balance. But then again, in September, it, flamed up. And then we had to do the first lockdown in the world. First time in the world, the second lockdown during the Tishrei holidays.
Right. Rosh Hashanah, Yom
Rosh
Kippur,
Hashanah.
Sukkot,
And then
yeah.
you are asking the religious communities, all Israelis, for them, it is, holidays as in for all Israelis. Ask them to sacrifice again their freedom, to go under lockdown again. And they have done that. They did a great job from the 18th in September until the 18th in October. For all 30 days, they've reduced the number of people infected per day from 9,000 to 900. This is unprecedented, the second most successful lockdown all around the world. And it took us a lot of energy to come to the public, to come to the people, to say, we were wrong. And now we have to go to another lockdown. And this is not a good timing because it's holiday time, but this is in your hands. We need your full cooperation, full understanding. We will win that. And I was talking about a new contract because we were asking our citizens, our people to do and to sacrifice more and more and more. People were not earning their living, were not seeing their grandpa and grandma, were not sending their children to schools, and all around the world, Europe and the States as well, people were not under lockdown.
Right.
So it was tough.
Do you think that now we're vaccinated, thank God, right? We're pretty much back to normal in the country. Are we done with this? Is it behind us?
I'm saying it's the disease, Corona as a disease, will still remain. But our challenge was to change the dynamic of an epidemic to a dynamic of a sporadic disease that we can handle. Still, there will be people with severe Corona infection hospitalized here in Ichilov, but there will not be hundreds, or there will not be even, 50 people. Now we have only up to 10 people with severe Corona.
Hospitalized
So,
right now?
so it's another disease. We are treating that.
Right.
The problem with the epidemic of Corona, that it overwhelmed hospitals, that government had to do lockdowns. So we will deal with Corona. Don't be aware of mutation. Don't be afraid of mutation. Don't do lockdowns in order to be, protected of mutation. Mutation of the virus will still happen. This is normative for viruses. It will happen. An escape mutation that the vaccine will not be effective against, I'm not sure that it's going to happen in the near future. I take that as a far incidence, and I'm not really want the government to plan ahead because of mutations. So I was saying to them, opened Ben Gurion.
Right. So I
This
want to
is-
ask you about this. That's
yeah.
great optimism. I'm happy to hear that. But do you think, just the other day, the government announced a relaxing of restrictions to
Yeah.
start to allow especially Olim's families to come in, people
Yeah.
who have a member of their family who live here. They weren't allowed to visit for
Yeah.
about a year now. Do you expect that to even expand more?
course.
Tourists will be able to come?
Israel should seek getting to normal tourism. And you know what? Gaining the opportunity now to have more tourism because we are the most green country in the world.
Right.
So yes, tourism, of course, families should visit. We can give green passport for people vaccinated all around the world or recovered from corona all around the world. Come here to Israel, and you know what? You can have a mass gathering and even shows, cultural events, international cultural events, any kind of conferences, international conferences. Israel should lead the way to the world. This is what we have guaranteed because we are the first country to have 90% people in the high-risk groups above 40 years of age vaccinated. We have to show the world that it's working and to give and build the trust not only for the people of Israel, but for all European Union, for the states, build the trust. Once you will be vaccinated, no more corona as an epidemic. You will have a victory. So this is why I was saying giving the numbers or giving the data to Pfizer is giving the data for the world. Because here we've shown that it's working, that the vaccine is very effective with very minor side effects, and it's working not only by protecting you from infection, but also reducing transmission rate.
Right. One of the things that we saw throughout the pandemic also is, while high infection rate, our mortality rate or fatality rate was not as bad, right,
Yeah.
per capita.
Only
Sadly,
0.775.
right. So sadly, there are lots of people who have died, but here Israel did well, and that to a large credit goes to the health system and to the hospitals and the intensive care units, similar to the ones that are here at Ichilov. What do you think is that part of that medical innovation ecosystem that we have here in Israel? Because there's all these studies that are always coming out of testing this and testing this new technique, this medication, cannabis, whatever it might be, to try to help with COVID patients. Is that something special here?
Yes, but I'm not really connecting that to the case fatality, to the low case fatality. Israel is very innovative. We have a DNA of a startup nation. We are taking the DNA of a startup nation that you can talk a lot why it was created, especially here in Israel, and we see that also in the healthcare arena. Medical innovation, medical biotech, biomed, digital health, artificial intelligence, we embrace and we are pushing ahead for our physician to be in the ideation spirit. I do not want my physicians, my nurses, to do the same that is written in the textbook.
You have some artificial intelligence autonomous system here in
Yeah,
Ichilov,
we
right?
have really a full department, a staff, crew that are putting a lot of effort into artificial intelligence. We have huge data. We want to use the data to do better medicine because we usually experience what the physician can remember. I want to hand him all the experiences of all the physicians, of all the patients, all around the years that have been here in Ichilov. And you know what? In many other hospitals. And it will make him a better physician. I want to do decision support once he is, confronting a very sophisticated case, a very complex case. And we are doing that. We are doing that, in automatic, in autonomic cars. We can do that in any kind of medical services. But you know what? It's not only AI, artificial intelligence. It's getting the medical devices, getting the molecules, doing advanced therapies, taking the physics into healthcare and pushing ahead. Corona allow us to understand humbly that we're a little bit primitive in healthcare. as opposed to other industries that went far ahead. A little bit primitive, meaning that in order to diagnose corona, it takes few hours. In order to diagnose it with a high, very high, 100% sensitivity. We can do better in healthcare. We have to take the technologies ahead and to use that for better medicine. And this is the place. Israel has a huge, ecosystem of startup, of innovation. Use that also for healthcare. And this is what we are doing here. We have our system, the IMED, the Ichilov Medical Innovation, and many other hospitals are doing that. We are trying to make our hospitals startup companies. And this is what we should do, and this is my desire, my ambition, and many other hospitals and sick funds as well.
So an injection of new talent coming as an aliyah, medical professionals, med tech, tech people, this would only...
Tech acceleration. They are doing the tech acceleration that we are all looking ahead for. And this is really fuel our strategy in pushing ahead for innovation. There's a lot to do. And you know what? We are creating now advanced therapies, not using drugs, chemical drugs, biological drugs, but engineering the cells, re-engineering the cells. The cells that carry a disease, I want to re-engineer them from the genomic level. We can do that. We are doing that now in CAR-T therapy. CAR-T therapy is a cell engineering for hemato-oncology diseases. We can do that for any disease. Do not use chemical. Do not use biological compound. Go to the cell. Re-engineer its physiology in order to treat the disease. Neurodegenerative diseases as well. There's a lot to do in healthcare. We are only at the tip of the iceberg. We have to dig down and reinvent medicine. And this is what we are setting an example here in Ichilov. And you know what? These people, the most excellent people are coming from the States, making the Aliyah, really are people that we need for pushing this excellence.
Okay. Professor Roni Gamzu, thank you very much.
Thank you so much.